I'm going to show you how to do a pelvic tilt or a cow, as well as hip circles and hip figure eights. These things help with circulation in your lower back, your hips, your pelvis area. They help with relieving some of that back pain and pressure because the ankles kind of get baby off of that pelvic floor and even kind of off that sciatic nerve if that's giving you a little trouble. The pelvic tilt also helps with the mobility of those joints in that area. So we will get started. We're going to start on our hands and knees, and you want your hands kind of right up underneath your shoulders. You want your knees kind of right up underneath your hips. You can also turn that out a little bit more if you need to, depending on how far along you are and how much your belly and baby have kind of gotten in the way. So you do your knees as open as you need to be comfortable with this. We're going to start with the pelvic tilts, and that is very similar to just doing the cat-cow. We're going to inhale and we're going to tilt up with our pelvis, and then we will release and you will exhale, and we're going to tuck under. And you're just going to repeat that 8 to 10 times. You're just going to do it with your breath work and just feeling the elongating and the contracting of those pelvic muscles. And once you've done that 8 to 10 times, you can do a nice little stretch back in the child's pose. That kind of takes some of that pressure off of your wrist and your shoulders. Just get you a nice little break in there. And then you can do these 3 consecutively and be done all as like one type of an exercise, or it can even just be done independently. It is entirely up to you and what makes you the most comfortable. You might find that some of these are more comfortable for you than others. So it really is very individualized. Next, we're going to do the hip circles. So you're just going to tilt your hips into a circular motion. And you start kind of small and widen that circle to your comfort level. You can do it about 8 to 10 times one way, and then go back and do it the other way. Again, just to your comfort level. These can be as elaborate or as small as what you feel comfortable. And once you've done that 8 to 10 times, you're going to stretch back, give your wrist a nice little break, and get that stretch up in your shoulders. And you come right back up. And the figure eights, very similar to the hip circles. You're just gonna use your hips to make a figure eight. And from there, you will do that a few times one way and come back and do it a few times the opposite direction. And that way you are kind of working all of those muscles in equal parts. And after that, you just take another stretch back into your child's pose. You can be doing that with your breathing. It's a little harder with the circles and the figure eights to do it with your breath. The pelvic tilts are very easily done with the breath. And then when you are done, you give a little stretch back into child's pose. You can do these a few different times a day, and it will help with the stabilizing and the mobility in your hips, as well as the lengthening and the contracting of that pelvis.